Hello, my name is Dr. Robert Arnone, and I am an upper cervical doctor. I focus and specialize in the upper cervical spine with head and neck injury, concussions, different misalignments of the upper cervical spine to the head. The reason for that is because the brain stem descends down through the skull into that upper cervical spine, and that is the source of all function to the brain and all function to the body. If you're someone who maybe looked up, maybe you did a Google search for Concussion Doctor, St. Charles, St. Louis, concussion, post-concussion syndrome, C1, C2 instability, there's probably a lot of different searches you could have done. But basically, if you're having trouble and you're not getting better, and you've had a head and neck injury, you're in the right place right here. So just hang in there for the next few minutes and let's talk for a moment. What I want you to understand are a couple simple things. One, I am somebody who has had multiple head and neck injuries, had health problems for years, like 12, 13, 14 years of health problems, that I was going the traditional route. Going to the medical doctor, being prescribed medication, doing over-counter on my own, trying different things on my own. Nothing really helped much. Exercise and sports and things like that, which were good for me, did help me a little, but really I still had headaches, I still had heart palpitations, breathing problems. So what happens is there's an injury there. When you have a concussion, there's a physical injury. I don't care who you go to see and they tell you it's going to be okay, just rest for a few days, rest for a week or two, and you'll be better. Even if your symptoms improve and you feel better, I'm telling you, I've seen it over the years. 100% of the time, when there's a concussion, there's an injury. And the injury must be corrected. Because here's the thing, if you don't correct it, and you say, well, I feel good enough, I'm going to go back and I'm going to put on my helmet and pads and I'm going to go hit again. Let's say you're a football player. I'm telling you, there's going to be future injury because the head and neck are unstable. We have what's called C1, C2 instability, cervical spine instability. The bones of the neck are in the wrong position and they get locked there. And it might only be a couple of millimeters off. It's not going to necessarily be a huge, dislocation, something that's tremendous that you would see on an X-ray. We will see the injury on an MRI, a CAT scan, or an X-ray. And really, X-ray shows it good enough. But we do that because we look at it from different angles and we measure and analyze. And we can see the problem and show it to you. And more importantly, fix it. We fix it in a non-surgical manner. I have a patient just the other day who said, Dr. Arnone, you are basically a surgeon in what you do. You don't use the knife, but you are a surgeon with your hands. Naturally, you're a surgeon. And that probably sums it up pretty much, because what we do is we're going to be very analytical about the injury, about questions, tests, and then, of course, when it's time to help and perform the specific, precise realignment or adjustment. It's done in a manner where there's no twisting of the head or neck. It's very safe. We've never had a problem with babies, kids, adults, the elderly, and we've seen many serious problems and conditions. Post-concussion syndrome does really well with this, and really it's what's needed. So I guess if you want, just reach out to me. We can talk about it further. We can see if this is a fit where we can help you. But I want you to understand that if you're just being told nothing's wrong with you and you're being given pills and nobody's helping, I don't want you to give up. I don't want you to become depressed or suicidal or angry and it's understandable. But there's hope. There's help. So please reach out to me. I'll put my contact information somewhere in the comments and just reach out and let's talk. Until we're able to talk, just know there's somebody out there that can help you. there's a very good chance that I can. Okay? The only way to know is to see you, talk with you, take you through some tests, and we will know. All right? Until then, just understand there's a better way. Don't give up. You can do it. Thanks for listening and watching. Take care.